Good evening to you all watching us live tonight. I'm Mchenry County Board Chairman Mike Bueller, and with me tonight are Public Health Administrator Melissa Adamson, Director of Nursing Susan Karras, and County Board Member Lori Parrish, who also serves as Chairwoman of our Public Health and Community Services Committee. Lori and I are going to co-host for tonight's discussion. So thank you all for agreeing to try something different tonight, an online town hall. And as you may have heard, McHenry County has entered phase 1B of the Illinois Department of Public Health's Vaccination Plan. The Department of Health has partnered with local hospitals and private pharmacies to begin administering the vaccine to seniors aged 65 and older. And later this week, we will be implementing a plan with our local school districts to vaccinate our education personnel. This is a vital step as more of our school districts reopen to in-person learning. We're here tonight to update you and to answer your questions regarding the county's plan to vaccinate as many residents who are willing in order to protect us against the COVID-19 pandemic. The vaccination program will allow us to reopen McHenry County schools, businesses, sports events, and festivals. Many of you have submitted your questions, very good questions, ahead of time via email. And tonight, some of you may want to ask them through Facebook's comments function during this live broadcast. We'll do our very best to answer them in the hour that we have. And we understand that this is an unprecedented demand for this vaccine, and we hear your concerns regarding the speed at which it's being rolled out. But the supplies are still scarce, just like how the COVID-19 tests were scarce when they were first rolled out at the beginning of the pandemic. This is a supply and demand issue. We have a plan, a good plan, for getting the vaccine into as many arms as possible. But just like other counties and other states, we're at the mercy of supply and demand, and they're facing the very same issues that we are. And without further ado, I'll turn this over to Ms. Parrish.
Thank you, Chairman Bueller. Feels almost like Groundhog's Day, right? We'll do this again. So I am Lori Parrish, County Board Member and Chair of the Public Health and Community Services Committee. And tonight's town hall will take place in 3 stages. First, we'll begin by laying out McHenry County's vaccination plan, a plan with which our Public Health Department has been developing since the COVID-19 pandemic began. This will include the steps our Public Health Department has taken to distribute the vaccine since it became available to us on December 28th, and what we can expect moving forward. From there, we will enter the second portion of this meeting where we will address the questions that many of you submitted prior to tonight's event. The third and final portion of the town hall will be reserved for at least some of the questions you submit tonight in the comments section on Facebook. But before we begin, I would like to take this moment to again thank our public health employees for their tireless work to keep our community safe. As the chair of the Public Health and Community Services Committee, I have had the opportunity to see these women and their staff answering questions and serving our taxpayers from the early hours of the morning to late at night, on the weekends, and even on holidays. I would also like to recognize the 226 Medical Reserve Corps volunteers who have been working shoulder to shoulder with the health department to vaccinate our residents. Many of these volunteers are retired senior citizens who once again answered the call to public service in our community's hour of need. I cannot thank them enough for their hard work and dedication. So with that being said, I would like to turn the floor over to our Public Health Administrator, Melissa Adamson, to discuss McHenry County's vaccination plan. Melissa?
Thanks, Lori. And actually last Tuesday was Groundhog's Day. So we are grateful for the opportunity to address the public's questions tonight. We get a lot of questions every day that we try to get answers to. This is a great forum for us to be able to address many questions and get answers for folks all at one time. So I do want to echo what Lori had started to say about our staff, right? It can't be overstated how much work and dedication this group of people has done. I am so proud and so fortunate to work with a team of professionals that go above and beyond to serve McHenry County every single day. In really adverse conditions, it's been a challenge, right? This pandemic has gone on for now the better part of a year. We have received many compliments about how smoothly and well organized our clinics have run, and it is a testament to the level of planning, logistics, and operations that staff put into each and every one of these clinics. And I welcome the time when everybody can experience them. So I'm going to start off by providing an overview of the vaccine process as a whole, and then Susan's going to give you some more additional details about our efforts to date. So IDPH has a vaccination plan. IDPH stands for the Illinois Department of Public Health, and we follow that plan, which is a phased approach. So everybody's heard about phase 1, 1A, 1B, 1C. Phase 1 is when the vaccine supply is limited. So it was actually expected that early on, after the emergency use authorizations were granted, that we would have a limited supply of vaccine. So part of that is then addressing who are those critical priority populations who need to be identified as receiving the vaccine first. And the guidance that IDPH uses comes from CDC and the Advisory Committee on Immunization Practices. So phase 1A is healthcare personnel and long-term care facility residents and staff. Then comes phase B. As the chairman said, we have started phase 1B. Those are persons aged 65 years and older, frontline essential workers, and inmates. And phase 1C is still a pending phase. It still could have additional recommendations. Currently, those in 1C are persons aged 16 to 64 with high-risk medical conditions and other essential workers. And then phase 2 is when we expect to see larger supplies of vaccine available. The allocation process. IDPH allocates vaccine to each county. The initial rollout was based on highest death rates. So those counties that had higher death rates received their vaccine first. Because McHenry County had lower death rates, we actually received our shipment the last week in December, which was nearly 2 weeks later than some of the other counties. As Lori said, we received it at the end of December, and our first shipment was Moderna. And we held our first clinic that same week to serve first responders. Vaccines are allotted on a weekly basis. They vary in size and type of vaccine received. So as you know, we have Moderna and Pfizer vaccine. So they come each week, but sometimes we get Moderna and sometimes we get Pfizer. Second doses are automatically shipped when it's time to schedule the second dose. Then what we do is we distribute vaccine to our community partners. That includes the hospital systems, pharmacies, and other clinics. And with that vaccine, we ship ancillary supplies that come with the vaccine. The first step in our process to enroll in an MCDH clinic and those that we are partnering with is to have people enroll. And that's where we gather information through an online enrollment form. It helps us estimate numbers of interested residents within each subgroup. And then that way we can further prioritize based on the vaccine supply. So once someone is enrolled, when there is an available clinic, we will send out notifications when it's time to schedule an appointment. So we send a link within an email for clinics. Individuals select from the dates and times that are offered to schedule the appointment. If a family enrolled as a household, for example, each person, so a link will be sent to that household to the email that was used to enroll. But when it comes time for an appointment, each individual will need to schedule an appointment and complete the clinic registration form individually. Once they've done that, they are going to get a confirmation email for their scheduled appointment, which will be sent with instructions to bring the following: an email showing their confirmation of appointment. We ask for identification. And then if they're coming for a second dose, we ask them to bring their vaccination card. When it comes time for the second dose, it's a similar process. We send links for the second dose appointment. Those are scheduled no sooner than 28 days for the Moderna vaccine and no sooner than 21 days for the Pfizer vaccine. So now I'm going to turn it over to Susan, who's going to give you some more specifics about our vaccination plan. Susan?
Thanks, Melissa. So the health department has been planning since March for this mass vaccination effort since the very beginning of the pandemic. We've had to make many changes with required COVID mitigations, and we have constantly pivoted with changing guidelines from the CDC in the state of Illinois. Mchenry County has a population of 305,570 people. Our goal is to vaccinate 80% of the population, which is 246,856 individuals. The vaccination requires 2 doses to be complete, which means we need to deliver 493,712 vaccine doses to achieve this goal. Public health, we use 2 different clinics. You'll often hear us talk and mention an open point of dispensing, or an open pod, and a closed point of dispensing, or a closed pod. The open pod is a clinic in which public health is hosting and administering the doses to the defined priority group. A closed pod is a clinic in which vaccine is provided by the health department and the vaccine is administered by the staff within that facility or sector. So in phase 1, as Melissa mentioned, this vaccine is scarce. And so the target audience was healthcare providers. So we are delivering vaccine to most of those are closed pods, such as the hospitals. Long-term care facilities are also high priority in phase 1A. They had a choice at the beginning of choosing to go with us as a closed pod, and we provide the vaccine and they deliver the vaccine to their facility staff and residents, or they could choose to go with a federal contract with Walgreens or CVS, in which Walgreens or CVS would show up to their facility and they would provide the vaccine to their residents and staff. In this priority group, there's an estimated eligible population of 8,500 people in Mchenry County. Phase 1B has an estimated eligible population of over 70,000 individuals. The population in this group that we are starting to vaccinate are first responders, 65 and older, which are about 44,000 eligible individuals, and educators, which is about 10,000 eligible individuals. Because of the large population in phase 1B, the Department of Health is prioritizing the subgroups based on the risk driven by data and science. However, there are times that decisions come from the CDC and the state that changes these priority decisions that are way out of our control. Mchenry County received our first allotment of 4,000 doses of Moderna vaccine on December 28th to vaccinate the 1A healthcare sector. 2,040 doses were distributed to Northwest Medical System and Mercy Health System. 258 doses to the participating long-term care facilities in our county that chose to go with us and not the federal contract. And 1,702 doses remained for us to start our clinics and open pods for phase 1A healthcare workers. As Melissa mentioned, that first week we held a couple clinics to get that started. The Department of Health's current capacity is 1,000 doses per week that we can deliver. Since December 28th, McHenry County has received a total of 27,854 doses. 25,700 of those were Moderna and 2,145 of Pfizer. 7,700 of these doses are reserved for second doses. 20,154 for first doses. Of the 7,700 second doses, 564 have been distributed to healthcare systems and long-term care facilities, and 2,076 are being used in finishing up our current pods for those second doses for those healthcare providers. Of the 2,154 doses, 11,284 have been distributed to partnering pharmacies, to Northwest Medical Center, Mercy Health System, and other community clinics to vaccinate the 65 and older population and have been administered in our open pods. The remaining 8,870 doses McHenry County Department of Health is using for the 64 or 65 and older population in our open pods, and 6,800 doses have been reserved for the upcoming closed school pods on February 11th and 12th. The Department of Health continues to reach out to community partners to enroll them in the state's Immunization Registry so that they can receive and administer vaccine. This is required by the state to do so. Currently, we provide allotments to Jewel in Crystal Lake and Cary, and Myers in Algonquin and Mchenry. That comes from our allotment. We have been informed by the state that federal allotments are being distributed to all McHenry County Jewel locations, as well as Mariano's in Crystal Lake. We anticipate more pharmacies in McHenry County will be onboarded soon. The current vaccine manufacturers are not ideal for primary care practice settings. There are multi-dose vials. Moderna is a 10-dose vial and Pfizer is a 5-dose vial. Once the vial is punctured, there is a specific time to administer all the doses in that vial, as there is no preservative used in these vaccines. For example, if your doctor or nurse practitioner administers a dose of Moderna to you at 3 o'clock from a new vial, he or she would need to give the remaining 9 doses within 6 hours, or they would be wasted. Not a popular responsibility for an already very busy office. So many of our healthcare providers aren't real keen on getting this vaccine within their office. So we are heavily relying on the healthcare systems to set up clinics, which they are doing. Northwest Medical has their clinic set up in Woodstock, and as well as Mercy in Harvard. MCDH has also secured 3 locations for drive-through clinics in Algonquin, Huntley, and Woodstock, and indoor clinic agreements with multiple high schools throughout McHenry County. The city of McHenry has stepped up, and we are working in partnership with them to provide a location, an indoor location for us to set up a clinic there as well. We also are requesting support from the Illinois National Guard through the Illinois Emergency Management Agency to help assist with delivery capacity. I hope that during this conversation, we can explain and clarify much of what is happening with the COVID-19 vaccine rollout to alleviate any concerns. To say this process has been difficult is an understatement. The McHenry County Department of Health, like every other local health department, is on the front line of this pandemic. And as such, we have continually had to make changes with short notice to adjust to decisions at the state and federal levels for which we have no control. This is not to say we have not advocated for the people of McHenry County. We have, and we will continue to do so. The health department staff have been working nonstop since March for the residents of McHenry County while balancing their own personal lives. Throughout much of my 30-year career, we in public health have trained to confront a pandemic. I honestly have to admit that no amount of training has prepared me for the challenges from outside of the medical and scientific realm that we've had to confront. Our goal this evening is to answer your questions, to explain why things have or have not happened, to give you the information you need to make educated decisions, and to explain the vaccine administration situation. Thank you.
Thank you, Melissa and Susan. If we could turn our attention to questions we've received by email prior to this evening. I have an email here from Judy Schmaus of Crystal Lake. Will I need an appointment when I'm notified that I can get my vaccine? How will I make my second vaccine appointment? And can I choose where I can get the vaccine?
So yes, currently all clinics are being scheduled by appointment only. That includes our clinics and all the clinics that I'm aware of out in the community-based locations. So an appointment is important, and we use it because it helps us ensure that we have the vaccine for each person that's signed up. It also helps us control a steady flow through our clinics and minimize unnecessary wait times for people. The whole process at an MCDH run clinic is approximately 30 minutes. 15 minutes of that 30 minutes is due to the recommended waiting time after you've received your shot to observe for any signs of allergic reaction to the vaccine. So it's a very efficient process that the staff have worked on and iterated on. When it's time for your second dose, we will send an email that contains links with dates and times to schedule your second dose. You may also schedule your dose at another community-based location if you prefer. Again, after you've been through one of our vaccination clinics, we give you a vaccine card. We ask you to bring that card. It's got important information on it. It indicates which vaccine you received, whether that's Moderna or Pfizer, and the lot number. It also has a date for your second dose. The date represents the soonest date you can receive your second dose. It's not necessarily the precise date that you are going to get your second dose. It may be obvious, but the second dose must be the same manufacturer as the first dose. So for example, if someone received a first dose of Moderna, they need to get a second dose of Moderna, same for Pfizer.
All right, thank you, Melissa. I have an email question here from Tim Jackson of Crystal Lake. There are several places that are taking sign-up information, like Northwestern Medicine, Meyer, Jewel Osco, and CVS is coming soon, as well as the county. How many of these should we sign up for? Is there any information that is being shared across these providers? And if we've signed up with the Mchenry County Department of Health, is that enough?
So again, if someone is enrolled through MCDH, we are going to notify them when a clinic becomes available. So we encourage everybody to watch their emails for links to register for a clinic. As has been mentioned, many of our community partners have also begun vaccinating our priority populations. So in those cases, like the hospital systems, for example, and some of the clinics are going to potentially reach out directly to their patient population if they fit in the 65 plus, for example. So they're going to contact you directly. It may be a text, a phone call, an email, or a direct mailer to schedule an appointment. So there's going to be multiple ways that people are able to schedule a vaccine. The state has also recently launched a website. It's coronavirus.illinois.gov. At the top left of that page, there is a graphic that looks like a map. And it says at the top, vaccine locator. So on that vaccine locator page, there is, you enter information about either your city or zip code. So you search by city or zip code, you set the geographic range you want to look at, and then up pop a number of retail pharmacies near you that are administering or soon will be vaccines based on the state's phased approach. There's also a qualifying statement that's on there that says, as the federal government distributes additional vaccine doses, additional appointments will become available. New sites and pharmacies are being added daily. Please check back regularly for available appointments. So we've heard from a lot of people that they go on this system and they can't find an appointment. And that is because the vaccine isn't coming in at a level yet where they're going to start populating those appointments. So we should start to see that change soon. And in terms of the communication or the information system, or sharing rather, these partnerships, so these retail pharmacy partnerships that you can see on this coronavirus or this vaccine locator page, they're utilizing their own appointment systems and getting vaccine directly from the federal government, as Susan had indicated. Now, where we have a local relationship or a local partnership with, say, one of these pharmacies that Susan mentioned, the Jewels, the Meyer, we do share information and coordinate vaccine distribution and appointments with these select pharmacies, but it's not the same thing as those larger retail pharmacy appointment systems. And then finally, we do encourage everyone to schedule their first available appointment that they can sign up for to get their vaccine, regardless of where that is. So if you sign up at a Jewel Osco or at a Meijer or at a Walgreens, for example, you're not going to roll off of our system, out of our database. So we would still contact you with a link when we have a clinic availability, and you can just then ignore that that email if you've already received your vaccines.
Thank you, Melissa. An important distinction, some of those locations do receive the federal shipments and not state shipments or through the Department of Health, correct?
Correct. So there's so the supply comes in differently. So that what is allocated to us as the county, we can then distribute, as Susan was saying, to those partnerships that we have. But there's many more retail pharmacy locations like the Walgreens that are going to get their vaccine separate and apart from the county's allotment.
Okay, thank you for that. The next question submitted from Bonnie Falcone. Do you offer the Moderna vaccine? And if so, is it possible for a McHenry County resident to obtain shot number 2 at a nearby location versus Waukegan, where he went to receive the first dose?
Yes, we do offer the Moderna vaccine. We do encourage you to return to where you received your first dose, but I can understand that if it was out of county or out of state, that's not going to be possible. So we will provide second doses in our clinics, but you need to enroll so that you get the links for the clinics. And you need to assure that we are giving the Moderna vaccine at that clinic. Because we are receiving Moderna and Pfizer. So you may register for a clinic that we're only delivering Pfizer at. So we will be posting in the link what vaccine we will be delivering in that particular clinic. So just make sure that you're signing up for that Moderna clinic. I would also encourage you to register with the pharmacies as well, as far as a potential opportunity there to get your second dose. It is very important for you to keep that vaccine card that you were given at your first, when you received your first dose, so that you have that card and it can be updated and they can see that you did receive Moderna as your first dose and that you are due at that 28-day or beyond for that second dose.
Thank you, Susan. I have a question here from Diane Trador. My husband and I are pre-registered for the COVID vaccine, or we did pre-register over 3 weeks ago, and I've checked numerous times daily for openings. My husband has a high-risk condition. Will we receive our vaccine in February before perhaps younger grocery workers and education employees?
If you are a 65 and older part of that population, you are a priority for us. I encourage, as you know, we've been saying, enroll with us, which you have, but I encourage you to also enroll with the pharmacies as well, and monitor and watch those locations as well. I also encourage you to reach, a lot of the healthcare systems, if you're affiliated with Advocate, Northwest Medical, or Mercy with your primary care physician, they are also going to be offering 65 and older clinics. So that might be an opportunity for your husband and you to get vaccinated as well. We do know that some pharmacies that are receiving allotments of the federal allotments are administering doses outside of that 65 and older, and they're vaccinating some of their staff. So we are hearing that there are some younger population, the younger population may be getting vaccinated in these stores or these pharmacies. So you are a priority in that group because the morbidity and mortality for that age population. I hear your concern, and I just encourage you to enroll wherever you can so that you can get the vaccine as soon as you can.
Thank you. The next one comes from Julie Lague. Are the vaccination clinics being set up at Woodstock North High School and Huntley High School only for teachers that work in those school districts? What about preschool teachers? Will they have vaccination clinic opportunities at these two high schools or elsewhere?
The high school clinics are a closed pod for all the school districts. So this is a unique relationship that we have developed with the schools. We felt like this was an equitable way to target and get as many educators into a clinic at one time, because it does include not just private schools, public schools, daycares, and preschools are in that group of educators. So in order for us to tackle this large population with as much vaccine as we can, we formed this partnership. It is a closed pod. There's a northern section. Woodstock North High School is hosting the northern region, and then the southern is Huntley High School. Two large facilities that can accommodate large clinics. We are providing the vaccine for these clinics and the support for the electronic registration in the system in order to the medical record system so that it goes into the state registry. The schools are partnering with their parents and their schools, their school nurses, and to get the volunteers to work these clinics. So it is a huge endeavor. We are, going to be vaccinating a numerous amount of people. We've allotted 6,800 doses for these clinics. And we're not going to be able to meet everybody's needs for these clinics. When they initially enrolled, we used that number from these facilities. When Melissa mentioned at the beginning that we asked for people to enroll so we can get an idea of how many people are actually interested, how many people would we need to vaccinate initially. Since we've gotten that initial rollout and have started this planning, many of the educators have changed their minds and they want to get the vaccine. We are not going to be able to accommodate them because we just don't have enough vaccine right now. But we will be offering future clinics for those teachers and educators. So it is a closed pod. It isn't just for the private schools or public schools that are hosting it. It is for every health education sector that's out there.
Thank you. I have a question here from Carolyn Bailey. Will taking an over-the-counter pain reliever 2 or 3 days before receiving the vaccine make the vaccine less effective or compromise it in any way?
There's no evidence that it does, but it is not recommended to take any kind of over-the-counter pain reliever prior to your vaccine. Take the vaccine. If you do start developing discomfort or pain at the site or muscle aches and pains, then at that time, we would encourage you to take any kind of over-the-counter pain reliever as directed and as what you normally would take.
The next one's from Colleen Jameson. My parents, who are both over 65, moved in with me from another state, but I have not yet changed their driver's license. Can they get a vaccine in Mchenry County? And also, I am my parents' caregiver and have a compromised immune system in addition to other health issues. Can I get the COVID vaccine in Group 1B?
Yes, your parents can be vaccinated here at Mchenry County. Again, you just need to enroll them at our website as well as any other pharmacy location. Or in lots where if you've established a primary care physician practice for your parents as well, since you've moved them here to Illinois, that healthcare system might be an option as well. Based on the needs that your parents have, you would qualify in 1B as a caregiver if they have extensive medical needs, such as technical needs, oxygen. If they're required to wear oxygen, or one of them is required to wear oxygen, those kinds of measures that are, technical support that they would need, you definitely would qualify as a caregiver in population 1B. And what you would need in order to enroll and register in that group would be a letter from their physician stating that they have these high technical needs and a chronic condition that puts them at extreme risk.
Thank you. Our next question is from Grace Moline. Over a week ago, I received an email to schedule an appointment, but was unable to as the appointments disappeared while I was in the process. Will I still be on the list to get an appointment?
Yes. So when we send out links, we do so that when we plan a clinic, right, we have a number of appointments that we push out, but we do push those out to more than the total number in case people are not interested or been vaccinated elsewhere, so we can fill those clinics. Again, we receive vaccine allotments each week, and that's how we plan for our clinics. Appointment links are sent in batches each week based on that vaccine that we have received. So once the available clinic appointments are taken, so let's say, you receive the link and many people, complete it ahead of you, then the clinics are full for that week. But rest assured, you do stay on the list. And if you're not able to sign up that week, another link will be sent to you in the future that you can sign up for a future clinic.
The next one is from Denise Lorman. My husband is 65 years old, works at a grocery store, and has COPD. I have heard of people younger than him and without health issues receiving the vaccine. Can you please explain how these shots are being delegated?
Yeah, again, we're prioritizing based on the risk and the data that we have, which is the 65 and older. If we are hearing that certain younger groups are getting vaccinated, but these are being done outside of our control. From what we understand, it is happening in pharmacies that have received federal doses. So they're administering it to the 1B and 1C populations, where we're trying to focus within those groups because of our allotments that we're receiving. So again, I would encourage your husband to register where he can, or enroll where he can, and reach out to his primary care physician's healthcare system to see about their clinic options as well.
Our next question is from Linda Trock. I'm in the phase 1A priority group and have received my first COVID shot, but have not received my second shot. Now we're starting with 1B. She's wondering, am I guaranteed to get my second shot now that you have begun with phase 1B?
Yes. So everyone who receives a first dose of vaccine is guaranteed a second. That's how the state ships vaccine to us. So they ship first dose allotments, and then they send an equal amount is sent when it's time to schedule the second doses. Again, second doses can be given no sooner than 21 days for Pfizer and no sooner than 28 days for Moderna. Again, when it's time for your second dose, we will send an email that contains links with dates and times to schedule your second dose.
Next one's from Greg Bergen of Lake in the Hills. I was recently told that I qualify as essential under manufacturing phase 1B, but had already enrolled as internet technology, which is phase 1C. I called to correct my status and was told that there was no difference in prioritization and it did not need to be changed. Is that correct? And if so, does that imply phase 1B and 1C recipients are being lumped together?
Well, Greg, I'm sorry that happened because that is not correct. We would want to get that corrected and get you into the right phase group. What I would encourage you to do is to enroll in the phase 1B, even though you've enrolled in 1C. What we're doing in the background is to look for duplicates, and you would probably be identified as a duplicate entry. And what will happen is we will probably receive an email from our epidemiology team that is going to question what group you need to be in. And that is at that point where you can provide that explanation of what happened, that you enrolled in 1C when you should be in 1B. And then we can get that corrected and make sure that you are in that 1B phase group appropriately.
Okay, our next question is from Denise Israel. What is our county going to do or continue to do about alerting residents that masks and social distancing must continue to be used for at least perhaps another year after getting their vaccinations?
Yeah, so now that we have a vaccine, you know, we do have more cause for optimism and hope. We can start to see a light at the end of the tunnel and envision a return to something that hopefully resembles normalcy, although I feel like normal, you know, how we define normal perhaps has shifted forever. But nevertheless, we are going to continue conducting surveillance to monitor for trends and disease transmission. We will continue to conduct case investigations and contact tracing and utilizing isolation and quarantine to minimize further spread. We will continue to host vaccine clinics, building those partnerships to support getting everyone who wants a vaccine in McHenry County vaccinated. Our county and regional data, for those of you who follow that, show we continue to move in the right direction, which I think is a reflection of the progress we've made as a community. So everybody should be proud of that. You know, it took a lot of work to get here. But we've also seen how we could step back if we don't continue to maintain our gains, right? So it's critical that we do continue to be mindful that the virus is still circulating in our community across the country and around the globe. So we do want to continue to encourage everybody to observe the universal precautions we've learned to practice in our daily lives. That's wearing the masks, watching our distance, washing our hands. And our communications with the public will continue to reinforce these kinds of messages. So that's not going to go away.
Chairman Bueller, if I could interrupt for just a second, and I'm wondering, Melissa, if you might reiterate the doing those things even after people are vaccinated, so it's not just people who maybe choose not to get the vaccine.
Correct. So, and Susan, feel free to jump in if you need to add anything to this, but keep in mind it's going to take a while for people to get vaccinated. And you may not know who's vaccinated and who's not vaccinated, right? So getting to that herd immunity, getting to that level that's going to help suppress the transmission does require us to continue to make these efforts when we're in public, and also want to encourage people to continue testing, right? So we now have testing that's pretty available all the time. And so universal precautions, and then continuing to test if people become aware that they've been exposed to somebody. We do reach out in those situations, but you're right, whether or not somebody's vaccinated or not, we want them to continue utilizing these universal precautions. And if Susan has anything to add, I welcome her input.
Yeah, we just don't know enough. You know, the vaccination, we know the efficacy, but how long it lasts is the challenge. We are continuing our contact tracing efforts and our case investigations in the nursing division. And we are collecting that information. We're required to start collecting that information as far as if somebody has been vaccinated, if they've been completely vaccinated when they're an exposure, or if they're a case. So that data is starting to come in, and it will teach us more about what are we looking at here, and it, you know, how long is it lasting?
Next question from Pete Croner. Is there a plan for drive-up vaccinations for those who do not move well or find it challenging to walk on potentially slippery walkways? And what about people that are homebound?
Yeah, as I mentioned, we do have secured 3 locations in the county for drive-through options. However, the weather has not been super conducive for just the working staff as well. So we need to protect the staff that are working these clinics, and to make sure that they're staying healthy, and that there's you know, that they're safe when they're delivering this. So when the weather improves, we're hoping that we can start using those locations. I'm sorry, what was the second part of that question?
What about people that are homebound?
Homebound. Yes, we are working on that. There's a lot of logistics that go into that. We're trying to stand up some strike teams, which would consist of some nurses that could go out and to help vaccinate the homebound population. We are working, we will be reaching out and have a relationship with home health agencies in our county so we can identify who these individuals are. The challenge is again, that piercing of that vial. Once we've pierced that vial, the clock starts beginning. So we would really we're looking at this and what the logistics would mean as far as who are these people, how do we identify these people in the community, and how do we kind of map out to get to them so that we can deliver these doses in a safe way in the home, and not waste anything. We're also have to explore, what about reactions? So we're looking at all the logistics of how we can set up these strike teams to reach those homebound residents in our community.
All right. I have a question from David S. Can there be a daily posting or newspaper report of the number of COVID-19 shots given each day in McHenry County, and to what group received them? Or perhaps is there already a place to find this?
Yeah, so there is already a place on the IDPH website. So if you go to IDPH, they have to specifically their COVID-19 site, there is now a vaccine data section. And the data are pulled from iCare, which is the Illinois Immunization Registry. And Susan mentioned it earlier, anyone administering vaccine must enter the data there. That's how we know how many people got vaccinated, right? Or how the state knows. So the data that is located on IDPH's website is pulled from iCare, and it's posted daily. It shows totals of vaccine administered by county, by the state as a whole. It also shows how many people are fully vaccinated. And then the state is beginning to collect demographic data for each vaccine that's administered. So I would anticipate that these data will then be reported in the same location, same part of that site.
Okay, thank you, Melissa and Susan, for your thoughtful answers. Let's start taking some questions from the Facebook chat. First one is from Joanne, who asks, I'm wondering why it's 4 weeks before the second shot when I hear most people get the second one after 2 weeks.
I think that's a Susan question.
Well, that shouldn't be happening because Pfizer is 3 weeks, 21 days is the minimum, and Moderna is 4 weeks, which is 28 days. So if somebody's getting the dose at 2 weeks, I would question that.
Thank you, Susan. Our next question from the chat is from Connie. I hear if you get one Moderna and second Pfizer, it's stronger. Is this true?
No, It is recommended that you use the same manufactured dose. And there's no evidence that interchanging those is any stronger.
Okay, the next one, Debbie asks, what is an open pod?
An open pod is a clinic that the health department is hosting, that we may open up to like specific criteria, categories of the priority groups, but we are hosting it, we're providing the vaccine, and we're administering and staffing that clinic.
Do we have another question from the chat?
Sure, you want me to ask that one? Sue asks, my husband and I are over 65 and have registered, but we've heard nothing back, either acknowledging our registration or telling us next steps. So it seems we are just lost in the process.
Okay, so what is possible that happened? So our system, we're unable to verify email addresses. So when somebody enters an email address, that's all our system recognizes. So if somebody entered it incorrectly, it's possible then that or if they didn't enter it incorrectly, they would not have received a confirmation email from us. So, but keep in mind that often our emails will go into spam or go into, the junk folder. So we do encourage people to look there. So if this couple does not find a confirmation from us that they have been enrolled into our database in their junk file, they haven't seen it in their inbox, I would encourage them to re-enroll. And as Susan said, we will be looking at duplicates and check their, be very focused in on the email address that they use to make sure that it is accurate. And then once they enroll, they should receive that confirmation email back that says, you are now enrolled. And then it states that this is not a registration for a clinic, but it just acknowledges that they are in our system.
Okay, and last question, Chester asks, what if you make an appointment and something happens and you have to cancel? Are you still on the list?
I'm gonna let Susan take that one.
Yes, you would still be on the list. And if you do have to cancel your appointment, I would encourage you to call and cancel the appointment so that we're aware and we can open up that appointment slot for somebody else. So if you call the clinic, the number is in the registration confirmation of where to call, and you just let them know that you need to cancel the appointment. We'll make sure that you continue to get links so that you can schedule for future clinics.
Okay, we have another question. Marcia is asking, do you need volunteers for any of these clinics?
Great question. So, I'll start, Susan, and then you can fill in if I miss anything. So we, as Lori, you mentioned early on that you thanked our medical reserve corps. So we have this great, amazing group of people. You don't have to be a medical professional to be signed up in the medical reserve corps. We have lots of different job duties, if you will, or job functions at these clinics. So we encourage anybody who's interested to go to our website, and you will find under our vaccine page, I think there's a option for how to volunteer. So follow those, and we can post, I think tomorrow we're gonna be following up, I think, with some additional information. So we could certainly post directly to that link. People can read through, and if they're interested in volunteering, they can complete the Medical Reserve Corps application.
Thank you for that. Well, we've received many more questions via email and the comments during this live stream, and we're reaching the end of our evening. We hope that you found this event helpful, and if you didn't hear your question asked or answered, please check the McHenry County website at mchenrycountyillinois.gov. That's il.gov, not the whole word Illinois. And in the next few days, we will post a list of the most commonly asked questions and our responses. So if you didn't hear yours here tonight, we will make an effort to answer them over the course of the next few days. So ladies and gentlemen, we're going to overcome this pandemic and we're going to do it together. So please bear with us. We will get these vaccines out as soon as they are received and to the appropriate groups.
And Chairman, if I can, before we close, I would like to thank everybody, each and every one of you who tuned in tonight or submitted questions. We know it's been a long haul since the start of this pandemic, and we really appreciate and are grateful for your ongoing efforts and cooperation. This is not easy. We want to reassure everybody that anyone interested in getting a vaccine against COVID-19 will have that opportunity to receive a vaccine. The chairman mentioned, likened the early part of the pandemic, where testing took a while to ramp up. The same thing is kind of happening now with the vaccine. So we expect it to increase and be much easier for people to find a location where they can get vaccinated. And finally, it just bears repeating, again, if you're sick, or we know you're sick of hearing it, but please continue to keep yourselves and your family and your coworkers and your friends safe by practicing those universal precautions. Stay home when you're sick, wear your mask, practice the social distancing, and wash your hands, even if you've already received the vaccine. So I want to thank everybody for tonight. And as the chairman said, I hope your questions, or many of your questions, were answered, and we will be posting additional responses to the questions we were not able to get to. So thank you.
Thank you so much. Have a good evening.
Good night.
Right.